Welcome to Beneficial Conversations, where we will explore the world of employee benefits and dive into the trends, challenges, and innovations shaping our industry. Join us as we sit down with industry leaders, HR professionals, policy experts, and thought leaders to discuss strategies for creating impactful benefit programs that support employees and drive organizational success. So whether you're an employee, a consultant, or you're simply curious, Beneficial Conversations looks to provide valuable insights, actionable advice, and inspiring stories to help you navigate the future of work.
Welcome to Beneficial Conversations. I am your host, CJ Jordan. Today, I have the pleasure of being joined by Kayla Shawn, the CEO of the Healthcare Navigator. Thank you for joining me.
Thank you for having me.
I'm very excited to have this conversation and just hear more about what y'all are doing, what y'all are seeing. But my first question to every guest to start the podcast is, I want to hear about the best meal that you've had. And it can be it can be something that you've made at home. It can be something that you've gone to or an experience, but I want to hear about the best meal that you've had.
I mean, right now that's coming up is ribs from Hutchins Barbecue in Texas. Um,
Okay.
but I would say the best meal probably is my grandma's chicken with love. It's
Oh
like
yeah.
the best little wingette fried chicken that like you'll ever have, and like you're like licking the whole plate. So I'll go with hers. I'm gonna stamp that in.
I can get on board with that. Like my grandmother, when she was around, she was an incredible cook. Like,
Uh,
we're not going to go into the ingredients of everything that was in there. It was good Southern cooking. Like,
yeah.
probably a little more butter than maybe there should have been.
Oh yeah.
But like, I mean, my grandmother's cheese grits recipe
Oh
were
yes, we love
like
grits. Yes.
famous. Like any time that we would have to go and bring something, or when my mom would come down when I was in college and stuff, and she would bring it, like all my friends would come over. So like my grandmother's cheese grits recipe reigns supreme. And then you're also speaking to my heart as a Memphis guy. Ribs are like I love me some good ribs. I know Memphis is maybe a little different than most places, but I've had some good ribs down in Texas too.
Oh my God, they're like that's the only reason why I haven't like moved. It's just, like you can't beat it in Texas. Either you go to Dallas, you go to Houston. I
Mhm.
don't. You can go to San Antonio. You can go down south, up north. It's all so good, and it's very It's not only like filling, but it makes you feel good inside, even though it's not good for you. So I mean, it's top.
Everything in moderation.
Right. I mean, who cares though, right? What's a little heart attack gonna do? Yeah.
And I don't discriminate. Like, if they're dry rub, I'll eat dry rub. If they're wet, I'll do that. Like, it
Yeah.
doesn't matter. I'll do just about anything.
As long as it's tender. If it's beef jerky, then I'm not gonna do it. But yeah.
I hear you. Well, so before we get into everything, tell me a little bit about your background. Kind of, you're coming up into this and how you got into it, and we'll start there.
Yeah. So the Navigator is about, or the Healthcare Navigator, interchangeable. We have been alive for about 3 years. So we started off as a social good app. So maybe most of your grandmas or grandpas have heard of us. So we were mainly a social good app that was essentially it was a method for us to help people who we thought, just were disempowered with the healthcare system, right? So most of our core 5 apps were already on the platform at that point, and anyone could go on and get whatever help that they needed. But essentially, we were created to engage with the healthcare system in a way that most people can't on their own, right? You
Hmm.
can't go and look up procedure prices. You can't go and compare quality scores. Most people don't even know what a quality score is.
Correct. Yeah.
And so all of these things, where from my background, I used to work in the healthcare, specifically hospital system. Most people who aren't in the hospital system or just in healthcare in general don't know the things that most people in the industry know, right? And I just believed it shouldn't be industry secrets, right? We're not
Correct.
trading stocks here.
Yeah.
We're not betting on anything. This is quite literally someone's life that we're talking about. And so I just think this access to information and access to the best care at the best price should be for everyone, because it's not trade, secrets. It's just healthcare. It's not
Preach
that.
it.
Yeah.
Well, and so you said you were in the healthcare space before this. So tell me a little bit about that. Like, how did you go from, I guess, being involved on the healthcare side to now it's, hey, I want to create an app that helps, with care navigation and steerage and stuff like that.
Yeah, so I had the pleasure of, I was that person in the company that people really took under their wing, right? In that hospital system that I worked in, right? They the way it worked was kind of like call it like franchises, right? So you
Yep.
have the big corporation, and then you have the hospitals, which they kind of call it like franchises.
Mhm.
And I had the pleasure of working with all of the hospital CEOs and the VPs, and they really just took me under their wing in terms of giving me just the inside scoop into everything at such a young age. And so, I got up all the way to the corporate level. So, you have the franchises and then up here. And I, again, same story, right? Was mentored by, the C-suite level at that corporation. And I loved it. I was very, very good at my job. I was very good at the
Sure.
strategy. Business development and strategy was essentially where
Okay.
I jumped off into this. And so, really great at my job. And I was on track to, as I say, like climb the corporate ladder, right? I
Right.
had um, all of the people I needed in my back pocket to just shoot up there. And it wasn't until one of my strategies that I had created, I had realized it was going to be used for something that I didn't intend it for it to be used.
Okay.
And so that's when, I brought it up to the person that was overseeing everything, and they could care less. They could absolutely care less. And one of the
Sure.
places that it was going to be implemented was actually in a space where my grandma lived and lives. She's alive still. Um,
Yes.
but it was in that place where she lives. And so when I found out that it was going to be implemented in that area, and I was like pleading, right? Like let's try and figure out another way, because when it's your
Yeah.
own grandma, it's different, right?
Sure.
When you're drinking the corporate Kool-Aid, you'll do anything to get that next promotion. You'll do anything. You're not really. I always say, like, you're kind of like brainwashed a little bit. Like, you're not
Sure.
necessarily. You're just thinking about how can I move up. And it wasn't until she got involved, my grandma, where I was like, oh my God, I've been doing this to other people's grandmas, to other people's wives, husbands, put the name in here. And so then that's when I decided to, like, okay, how can I kind of pivot away from this? Because
Yep.
that's when you start kind of like waking up in a sense.
The
And
damn it moment.
yeah, sorry, say it again.
The damn it moment.
Yeah, the moment where it's like, oh my God. And like you're in the middle of basically the murder scene, and you're the one holding the knife.
Yeah.
And you're just like staring at yourself in the mirror. And it was just that was one of the hardest times of my life, because I'm
Sure.
such an ambitious person. I
Right.
mean, I will like run over whatever I need to run over to get, at least at that time, I would
Yeah.
ran over whatever I needed to get to, that next level.
Mhm.
Um, so she kind of brought me out of that. And that's when I started to pivot to understand, okay, how can I essentially right some wrongs here? Because I just
Yep.
really, it was hard for me to live with myself, knowing what I had done and seeing my grandma in so much financial pain from the thing that I created, right? And so that's kind of how the Navigator was born, was how can I essentially make it so that patients don't fall into systems or like sites of care that already have these traps in place, right? No matter, like, if you get in there, they have this trap set up for you financially that's just
Mhm.
going to wreck you. And so how can I kind of give some sort of GPS or some sort of way to right these wrongs in the
Right.
best way I can? And so that's essentially how it started, was, that pivotal moment for me.
And so it sounds like, I guess, did it start out more as like a direct to, I mean, almost like consumer, that you're trying to just get this in the hands of, anybody that was wanting to access the information? It wasn't necessarily on a group basis, but more of, hey, this is something that can help an individual person? Like what was the first iteration of that, and then how did it kind of evolve from there?
Yeah, so great question. It was a
Okay.
it was consumer led, right? So we were B2C, and we were running all the Google ads we could, and we got on the news a few times as well. So it went really well.
Okay.
But it wasn't until when we got on the news a few times, that's when employers started reaching out to us. So that's when not only even employers, but like the major broker houses, so like USI, for example, they were one of our firsts that
Mm-hmm.
saw our news segment at least. And so that's kind of how it kickstarted into the group setting, was when we realized, oh, we can actually help a lot more people if we go the group route. Because the consumer route, it's kind of like one by one
Yep.
by one by one.
Yep.
And I can be very impatient. I can be very, very impatient. And so I was just like, this is not fast enough for me.
Right.
How can we like accelerate this? Because at this point, everything had been built, right? Everything had been, ran through by the National Patient Advocacy Foundation. We're ready, right? So what's the best way? And so when we found that there was interest from the employer side, that's when we started exploring it. So that was about a year, I believe, into, yeah, that was at the end of our first year that
Mm-hmm.
we started getting into the employer space. And now we're full time in the employer space, just because, again, this is how we can, go to the most people.
Right. Was it from a user standpoint, like it doesn't seem like it would change necessarily whether you were starting out with the B2C and now you're kind of going the B2B, but like the functionality seems like it would still be the same. You're just obviously scaling at a little bit larger clip by going into a group that has a few hundred or a few thousand employees or whatever, as opposed to this house, this house, this house. Like it seems like the functionality would still be the same, or am I wrong?
So I guess like let's define functionality maybe. Because from a remember tech girl here. So
Yep. Yep.
from a tech perspective, no. The functionality was we've had to upgrade servers even in this month 4 times.
Wow.
So because just the growth has just been insane. And again, God bless, thank you. But it's so the functionality in terms of the data, right?
Right.
Because when you're thinking about it from an operational point of view, we are an 11-in-1 solution. So your average healthcare navigation is going to have 3 or 4 solutions. So they might do price transparency, provider prices.
Mm-hmm.
They may, do the phone call. Great. We do 11-in-1. So, right. So we do price transparency, labs, medical bill negotiation, clinical decision support. I could list them on. I mean, you go on
Get
and
your
on.
pen and paper out. Let's go.
And then we also do in-person navigation. So we do
Right.
it like this. So the data that it takes to have all of the hospital prices is enormous. To have
Sure.
all of the insurance, right? So that's all, not just your bucas, but your tiny little insurance companies, all the way to the bucas. We got to have all their prices in there, and then
Yeah.
we got to have the EOB, or not EOBs. We have to have the SBCs, the summary of benefits coverage, and we have to have the formularies, sites of care policies.
Yep.
You name it. And so that the data itself is enormous. I can't even begin to describe how much money it has cost us
Sure.
I mean, it's worth it, right? To be able to have it all, to be national like we are. But from a functionality in terms of the apps have stayed the same, right?
Right.
Because all you need is your summary of benefits to load all that in, your deductible. When we connect with your either insurance carrier or your TPA, whoever you're using. So that's the same. But in terms of the actual the tech side of it, it is completely different.
Sure. And you may have if kind of glossed over it, but I want to make sure that we really kind of emphasize this so that people understand. Tell me and just explain what the problems that you and your team and the Healthcare Navigator are trying to solve for companies, and then even down a little bit further specifically to the employees. Like what is y'all's mission? What is it that you're trying to do for them?
Right. So the short answer is we're here to help companies get their power back from healthcare.
Yeah.
You've looked at your financial statement lately. I'm sure most companies have either seen an increase or at the very least extremely large numbers. In our cases, we're seeing, millions in terms of expenses for healthcare. And for most, I believe it's number two for employers. Healthcare is the number two most expensive expense on their reports. And so what we're here to do is help you get your power back. So what does that mean? That means all of the things that you cannot essentially control and on your own, we help with, right? So that means most of your employees right now, if they don't have a navigation service in their benefits, that means they're flying blind, right? They're picking hospitals based off of who their grandma went to 5 years ago.
Yep.
Or some sort of, their friend said to go here. They're going to this doctor because they found a cool ad on a magazine and it said, number one doctor in Texas or whatever the case may be.
Yep.
And so, they're flying blind because all of that's marketing, right? That's not actual. None of those are great indicators that this is a cost-effective, high-quality provider. And so why that matters is that with employers, you need your people to go to the best quality and best cost effective provider so that you're not being charged enormous, ridiculous prices for procedures.
Yep.
And that you're making sure that the people you're going to are the best quality, because just like if you get a cheap watch, it's going to keep breaking and going to keep breaking. And the cost of a cheap watch is even more than a quality one because you have to keep replacing it and things are wrong with it. So that's the same thing with providers, right? If you get an infection, that's $15,000 at the very least added onto your medical bill. So we essentially think of us as the GPS for your employees, where like your insurance, your broker, right? They'll tell you, you guys will make a plan with them and you'll say, okay, this is the end goal. We want them to go to the best high quality, low cost side of care. This is how we're going to lower claims and improve health. Great. How are we going to get there? Right? How the heck are they going to know?
It's a great idea. Everybody wants to do it.
How are we going to do that? And so that's where we step in, is we're the GPS. We are the guardrails where we think of it as there's 1,000 different turn signals. We make sure like you are on this track, you're going to stay here. So it's a very controlled way to make sure people are utilizing the plan as intended and making sure that the companies are actually seeing the results because we're helping drive the ship, right? No one right now is actually driving the ship except for the employee. So we're there telling them, where to go. Does this drug require step therapy? So you may want to try this one instead. Let's maybe not do surgery right now. Let's do rehab. So, we're that GPS or the brakes essentially to make sure that they're not going off course like they are right now.
Well, and it's so, you and I know this because we live it and breathe it, and I can't remember what the number is, but the majority of Americans don't realize that the costs for MRIs vary so significantly depending on where you're going and who's doing it. Like the cost of getting an MRI within like a hospital setting can be significantly, like we're talking like 3, 4, 5, 10 times the amount that it could be at an independent facility to get the exact same test done. And it's like people just don't know. And so obviously information is power. So the ability to provide employees and employers with the ability to shop appropriately, I think is just such a huge value add. It's not a discount. Like you're not going from here in some fancy clothing store down to some discount one. It's like, no, it's literally the exact same thing, just at a place that's not going to mark it up by God knows how much.
Well, yeah, I mean, and for MRI, for any like tests, of course, the quality is it's going to be the same either way. But when we're looking at surgeries, quality differs by a long shot. And we actually did this in our 2025 CFO playbook for rethinking healthcare costs. And essentially, what one of the studies in there found was that with surgeries, how people think, okay, if it's a high cost surgery, that means it's better quality. That's actually the opposite of what we found. So I believe it was for not an endoscopy. I forgot what the surgery was, but essentially, it's within your gut region. I'm sorry, I'm blanking on what
You're
the
good.
surgery is, but essentially, what it found was that all of the low quality hospitals, I think it was about 85% of the low quality hospitals, had the highest prices.
Mm-hmm.
So that means they had the highest infection rates. So that means like the historical amount of patients who've gotten that procedure at that hospital, 15-20% of them, just making up numbers here, got an infection, versus the low infection hospitals, the ones that had the lower rates, they actually had medium to low prices.
Yeah.
So it's completely opposite compared to what people think traditionally. And that's why, for example, with us, I know a lot of, navigation sites, they just focus on pricing. Well, that's not the full story, right? You have to look at
Mm-hmm.
everything, and it's a lot to get everything.
Sure.
But when you see that, oh, actually, for most surgeries, higher quality, that those higher quality sites are actually going to be medium to low price, because if you think about it, they have so much volume coming in because they know from other providers know that that hospital is a high quality hospital. So
Yeah.
their volume is there. So they don't have to hike up the price.
Right.
So when you think about it logically, it makes sense. But in the traditional realm, most people think that it's the opposite, and it's not. And so that's why it's so important to have both quality and the prices. And if you need to, have someone to call like us so that we can tell you that kind of stuff instead of you just flying blind.
Yeah, because I know hospitals are technically supposed to be publishing prices and there's supposed to be a level of price transparency, but it feels like it's very opaque, or you're having to like click around in 15 different areas to maybe get a hint of what something's going to cost. And it's just, I know like some hospitals are doing great, like the Surgery Center of Oklahoma, I think, is one of the most famous for just saying, hey, here's our cost. Here it is. We'll lay it out here, and the bundling and everything that goes into it. And I wish that there was more transparency. I know there's supposed to be, but I don't feel like there hasn't been any recourse for not publishing it. So I feel like most hospital systems are just going to continue to function, the way that they have. But so I mean, are y'all just able to scrape the information to be able to gather that, or how does that part work? And,
Yeah.
if you can give away that part.
Oh yeah. I mean, it's a lot of work. So that's why I'm not afraid.
Sure.
I'm not afraid to like talk about it, because it's
Yeah.
like good luck. We're over here dying as it is, like getting all of this data. It is, I can't even begin to describe how much data is and how difficult it is. That's one of the reasons why people go to us, because we have the most out of anyone. But the process normally is, so the hospitals, like you said, they publish their prices. It's gotten better over the years, right? The first
Okay.
3 years absolutely was just horrendous. But what we're seeing now is that because there has been so much activity within the benefit space, specifically around transparency and around, getting the best prices, we're seeing a lot more hospitals actually post them because they see that there's a market for this, right? People are looking for these prices.
Yeah.
Um, so it's a few things, right? The hospitals, they publish their pricing, but also the insurance companies publish their rates as well. So that might sound like, oh, then why can't I just go to that hospital, click on it? It's because if you try to do it, and I invite anyone, please stop this podcast real quick so you can see what I'm talking about.
Come back.
Let me know what you think. Because it is quite literally one of the most horrendous, biggest Excel sheets you'll ever see in your life, right?
Yeah.
It is an MRF file, which essentially means you basically need a supercomputer to download all that data, and then to sift through it. It's not just hundreds of rows, not just millions. We're talking tens of millions of rows. And some of those rows are, we call them like illusion rows. So sometimes hospitals will try and be sneaky and say, oh, if we just give them in the beginning a bunch of just weird rows, then they'll just click out of the Excel file so that they don't see our actual prices. So there's a lot of like tricky business happening, but also if you do manage to go and go through that, then try and decipher the information, because it's all in medical terminology. It's
Yeah.
all in
Good
medical
luck.
terminology. So unless you have some sort of medical training to know what XCLAPSL10024 means,
Yeah.
you okay, go ahead. So once you actually get into it, you find that it is not consumer friendly. You
Yeah.
don't know what it means. Plus, there's a bajillion different numbers associated to it, right? So to actually decipher and understand what the information is, you really do need navigation. So again, to go back to your original question, hospital prices, but also we look at insurance, their published rates, and then we also look at claims, historical claims, and then we have a few other methods to make sure that the data that we're getting is actually good, right? And
Yeah.
it's quality. So it's about if I remember correctly, it's a 9-step process. Normally it takes the whole 4 months. So we normally do it quarterly.
Mm-hmm.
Quarterly, sorry, 3 months. So it normally takes 3 months just to refresh the data, and that is a computer doing it itself. So it takes 3 months for the computer to do it, not a human,
Yeah.
not me writing stuff down, a computer to do it, AI generated as well, helping decipher through that. So it's a lot to get through it, but again, that's just where we're at right now. Someone's
Yeah.
got to do the hard work, and it just happens to be us.
Yeah.
So that's where we are right now.
So take me through a case study, because I feel like this can, and a case study, an example about how this could help a specific person. So let's take me back in 2016. I had a bunch of shoulder pain. You know, what is my take me through how I would access, the Healthcare Navigator from the beginning
Yeah.
all the way through the end, because I don't think it stops.
Yeah.
Actually, I know it doesn't stop just at the care navigation piece.
Yeah.
Walk me through each step that I'm engaging the healthcare navigator throughout the course of, my care about,
Yeah.
needing my shoulder to get looked at. Cause I feel like this is a good way for somebody to understand, it's not just one level of engagement that you're having with it. There's multiple factors, multiple layers to it. So let's take my left shoulder as an example. And what am I doing with your app to be able to go through my whole care navigation process?
Yeah, great question. So let's first it's in two slices, right? So if you are, let's say you have you're older, right? You don't want to use the app, then
Yep.
you're just gonna call our nurse navigator
Okay.
and they'll do the traditional navigation, which is the same thing as the app.
Yep.
The app is just the millennial and Gen Z version of
Sure.
the traditional realm, right? Because everyone wants to Amazon everything these days. They want it quick and they want it.
You've got to cater to all generations. I mean, we've got so many spread across the workforce right now, so it can't just be, you're going to take this and you're going to like it. So, I mean, I appreciate the fact that there are multiple options for people to be able to get access to it, or to be able to, get the help that they need.
Yeah, and so that's the first one. But for the app, if you have shoulder pain, I think is what you said.
Yeah.
First, normally when you open the app, it's going to show you right now where you are in your deductible, where you are in your out of pocket, all of that great stuff.
Yep.
And normally you're going to go to our benefits manager. So that's it's a chat bot essentially, where it has access to your health plan information. So CJ,
Okay.
not Kayla's, not anyone else's, yours specifically.
Okay.
So when you type in, let's say you type in, oh, I'm feeling like I have some shoulder pain. What do I do? Then it'll let you know, okay, for shoulder pain, because it's connected to all of our other apps. So it'll say for shoulder pain, you're going to want to talk to our Care Genius that gives you clinical decision guidance, which means I'm going to help you understand what your options are for addressing the shoulder pain. And then it's also going to tell you essentially what's covered under your plan for shoulder pain. So you are covered for rehab, let's say, you are covered for rehab. You are
We're going to
covered.
go to physical therapy first, maybe as the first option before we even look
Exactly.
at getting cut on. Yep. Okay.
Exactly. So it'll always do the conservative care first. That's what we call it.
Okay. Yep.
So that's your rehab. So then you're going to go to, it's going to prompt you to go to Care Genius. So click on it, go to Care Genius. Again, type in, I feel like I have shoulder pain. And then again, it's going to give you all of your options from a clinical standpoint. So again, this is not a doctor, it's not medical advice,
Yep.
but this is pulling from from the Merck manual, which if you don't know what that is, that's essentially it's fine. It's essentially what your doctor uses when they're talking to you. It's like the doctor handbook essentially.
Okay. Yep.
And so it's trained on that. So think of it like a textbook that they use for medical.
Sure.
So it will tell you all of your options from conservative care all the way down to like the most extreme. It'll say, okay, you're first going to want to first talk to, if it's a shoulder, then you're probably going to go to orthopedic surgeon, or not surgeon, but just, orthopedic specialist. So it'll say, we recommend you go to orthopedic specialist. These are some that are in your plan and that are in your area.
Okay.
Really important that they're in your plan and in your area. But also, I think one thing that's different from us than anyone else is that we don't accept any doctor, right? So you're never going to see a doctor that has horrible quality metrics. I don't believe personally.
Sure.
Like if my grandma's on this thing, right? So I know she's gonna pick the first one. She wants to get in and out.
Search engine optimization does not apply. Like marketing, whatever. That's not going to apply. It's based off of quality and everything. Yeah. I get it. Yeah, makes sense.
You're only going to see doctors that have a MIP score higher than 75. Okay. And so then you can pick your doctor, which one you want, right? So that's in the Pocket Doc, right? So that's why, you're going to Benefits Manager, it'll take you to Care Genius, and it'll take you to your Pocket Doc, where you can find the best doctor for that. That's both high quality and cost effective and in your plan, which is extremely fine. And just for anyone who doesn't know, right now there's about, I think, 8 million, I want to say, doctors in the US, but only 300, almost 400,000 are actually high quality. So just let that sink in. We're not looking good. And on top of that, I think about 30% of the workforce for physicians, they're going to start retiring in these next 5 years. We're already seeing a decline. So now more than ever, it's extremely important for employers to have some sort of navigation, because if the pool shrinks, then it's really important for you to know where to go, because if the number of high quality providers is also shrinking with that just means your chances of selecting a low quality one without navigation are that much higher.
Right.
And so then you're going to go to your orthopedic specialist. You'll see, that's when you and them talk, right? We're not doctors, but we're here to help you go to where you need to go.
Yep.
And then from there, let's say he says, for orthopedic specialists, sometimes they're known for just going straight to surgery, because that's how the corporate healthcare system works nowadays. Sure. And so, they're probably going to say, oh, you need surgery. When you use our app, we're going to tell you, ask your doctor if rehab is an option first. And you will not believe how big of a difference that makes, because again, normally they just know to go to surgery first, right? That's the easiest way to make this thing fixed.
Yeah.
But let's consider this. Let's consider maybe a shoulder shot for your maybe it's something where like there's an injection that we can do to help that, right? So ask them it'll tell you to ask them to consider these things. If, let's say, you didn't do that and they say that they're gonna just go to surgery, us on the Navigator, we see what's going on in the background, right? So CJ is gonna become a risky, we call it like a risky claimant. So what that means is you may be at risk for doing a extreme surgery, right?
Yeah.
So we're gonna check in with you either by the app, just to say like, hey, basically to check in to see that basically what happened.
Yeah.
what happened so that we know, okay, if our nurse navigators need to meet with you to make sure you know, hey, there are other options. You don't just have to go straight to surgery. And most people want to go straight to surgery, right? That's not. So we have a few safeguards to make sure, okay, if you didn't see that notification on your app, you're going to get a message, you're going to get a phone call from us, like you're going to talk to us whether you like it or not. So that's kind of how the flow goes, so that we're always there as you go through the care journey, even if you're not constantly on the app.
Right. And it doesn't sound like it's like you're trying to come in there with white coat syndrome, whenever you're talking to the doctor, but it's just more of giving you information to ask the question of the doctor. Hey, is physical therapy, I mean, not going in there and diagnosing yourself and all that kind of stuff, but at least giving you the ability to ask intentional questions that maybe you hadn't thought about, prior to, like, hey, what could physical therapy look like, and have them be able to elaborate on that. Would a steroid shot in this scenario be something that, could alleviate some of the issues? So again, I don't think that it's necessarily trying to push back on the doctor or anything like that, but at least asking the question and hearing a response. And he might give you a response and say, hey, based on what I'm seeing XYZ, this is the reason that I'm, recommending, this specific step. So they might stick with their course of action, or I feel like it could also create opportunity for additional conversation between the patient and the doctor. Like, you might ask this question and the doctor says, okay, well, what's your end goal with this? Like, for me, I was younger, like I want to make sure I have full mobility and, be able to throw the baseball with my kids. But if it's somebody that's older, it's like, look, I don't need to throw the baseball anymore or what have you. Like, I just need to be like somewhat comfortable. And so I guess I think it just could create opportunity for additional conversation to happen between the patient and doctor, and, allow the conversation to go from there, I guess.
Yeah, I mean, I don't know if you have had any healthcare professionals in your family, but it's the same way if your sister or your mother was a doctor, right?
Yeah.
Anyone who has had, or a nurse, right? If anyone has had any healthcare professional in their family, they're gonna tell you to ask these things to the doctor. If not, just go to the appointment with you, right? So it's the same thing. It's, hey, make sure you ask these questions, and not only are we gonna, give you quite literally a list on what to say. The app gives you a script on what to say. Our nurse navigators follow up with you to make sure everything went well. They're happy to be on, like write up anything you need, listen in on whatever you want them to. And so it's think of it like having a nurse in your family to guide you through the process.
Yeah. So, okay, so we take whatever course of action happens. Maybe it's surgery, maybe it's physical therapy, something along those lines. Does it stop there as far as how y'all, continue to help the specific person? When you get bills and stuff like that, is it done, or what is I guess, are y'all still involved post treatment, or how does that work for y'all?
Oh God, yeah. I just say that because it's like I can't wait for the time. I know that navigation has recently become a huge commodity when it comes to benefits, and we've gotten so much demand, especially just this year alone, because premiums are spiking everywhere, especially at this renewal season. So, but I can't wait for when people really start to understand how much navigators actually do, at least the good ones.
Right.
So to answer your question, after, let's say you do the rehab, or let's say surgery was the absolute option, right?
Sure. Yeah.
Okay, so surgery is the absolute option. Okay, fine. Let's make sure that the hospital you get this done at is the best quality, most cost-effective option that doctor is credentialed in, right?
Sure.
And it's in your network. So all those factors, we make sure that, make sure you tell your doctor that you want to go to this hospital.
Yep.
They're credentialed there, et cetera, et cetera. And so that helps, at the very least, that helps with the cost, because, maybe you have to get surgery, but let's make sure where you get it is the best place, because as you know, you have 4 pillars for the claims. At least that's what we call it, right? We have the 4 pillars for the claims. You have the place of care, the provider, so the doctor who does the care, what the care actually is, and then when you get that care. All of those influence the claim, right? Because if you're getting care at a delayed time, that means you're probably going to be sicker. Or if you're getting the care at a really high cost place, it's going to be a higher cost claim. If you're getting care with a low quality doctor, again, higher cost and more pain on you, right? Because you just got the infection or whatever complication. And so those pillars react. And so, all right, we know the hospital that he wants to go to. We're going to make sure that you're prepped when the time comes for you to do that surgery, because you get anxious, right?
Oh, yeah.
So that's when the mental health therapy comes in. So we have our mental health. You can either do our mental health therapy AI, which a lot of the millennial and Gen Z love nowadays, or you can do an in-person therapist. And this is all on our platform, right? So then you you'll be prompted by LumiMind, which is the mental health AI, to, all right, you're going to have surgery coming up. Let's talk about it. How are you feeling? Et cetera, et cetera, et cetera.
Yeah.
Or you go to the therapist that you want to go to in our plan. And then from there, you'll be prompted by Care Genius to let you know what to expect before the surgery. Because that's another thing. Most of the anxiety just comes from, I don't know what's going to happen. I have no idea. So let's try and dispel some of that. So, all right, here's some of the things that you can expect. You can expect, XYZ from your insurance company, or you can expect this from your doctor. And then it'll say during and after the fact what to expect. So you'll get that from Care Genius, so that again, it's just less stress on you. Because again, I mean, I don't know if you've ever had like the stress of just having to go to get surgery, or your kid has to go to the hospital for some reason. When you're stressed about that, you're not thinking about your work. You're not thinking about the deliverable that you have on Friday. You're not thinking about that. You're just thinking about either you or your kid or whoever is sick. And so this really does help with the productivity part, right? Because everything's taken care of for you, right? We are quite literally kind of like momming you in a sense. Or like a white glove service in a sense. So that helps to decrease that stress. And then after you do the surgery, you'll get your EOB, you'll get your bill, and then we'll run through either you or the nurse navigator, depending on how long. If you want to do it, great. We have the app that you can just copy and paste it in. But if we see that you haven't used the app, then our nurse navigators will just go ahead and do it. Because again, no claim will be left untouched by us, whether it's you or us. And so then the claim will be looked at to make sure there are no errors, because you know best, right? 70% of medical bills in America have some sort of error or overcharge. That is,
I thought it was even more than that, to be honest. I think you're being conservative with the 70% number.
Is it 70 or 7? I remember the 7.
I think it's higher. I'll trust you, but I think 70% is conservative.
Yeah, I mean, it may have increased nationwide. That was the last stat that I saw.
Regardless, it's the majority. We know that much.
Yeah, it's not the best at all.
No.
Right? And so we'll go through to make sure there are no errors. So what does that mean? So that means there are no duplicate charges. So they charged you for the same thing twice. No, that's not going to happen. Let's say they charged you for something you didn't get. That happens all the time.
All the time.
Or let's say they charged you, they accidentally, because this can happen too, right? They gave you the wrong CPT code. So they put a 7 instead of a 5 at the end of the 4-digit or 6-digit code. So that difference, like, quite literally changes the whole thing, because that's a whole different procedure. So that one difference can go from $5,000 all the way to $15,000.
Right.
So checking the CPT codes. So that's what we'll do to make sure everything's okay. If it's not, we will make the appeal letter for you. We'll negotiate it for you. We'll do all the dirty work to make sure that you pay what you actually owe. That's it, right? And then from there, after that happens, if you're like a risky claimant, right? So let's say you have cancer, we'll do regular appointments with you to make sure you're okay. Like, okay, you just got chemotherapy. what's the next thing that your doctor said? What's the next thing that's on the list? Because there's a
Yeah.
laundry list for cancer, right?
Yeah.
So depending on how risky you are, we'll check in regularly with like an in-person navigator. If you're not that risky, and let's say you're just, you're pretty regular and you're fine, you'll get notifications on the app just to make sure everything's good.
Yeah.
But you won't need like a regular appointment. So that's kind
Right.
of, it just depends on what kind of patient you are and
Right.
where you are in the process. But that's
Yeah.
kind of how the flow goes.
No, it's incredible. Like you have an advocate for you at every step of the process, from, prior to meeting the doctor to, while you're there, after, and then, after the treatment has happened. Like, having somebody there who's got your back and who's making sure that you're being taken care of, that you're seeing the right people, that you're being charged appropriately. I mean, that's all you can really ask for when you don't know how to navigate the system, because
Yeah.
it's so ridiculously complicated and convoluted. Like, even somebody who lives and works in this space, like, it's still difficult for me, and, like, making sure that we're going to the right places and stuff like that. So just having somebody being able to do that, I feel like, has to give a significant amount of peace of mind,
Mhm.
on an individual level.
Yeah.
And
And
so,
yeah, go
go
ahead.
ahead.
I was
Well,
gonna
no.
Sorry, I
Yeah.
was gonna say, from the company standpoint, it also gives your CFO a hell of a lot of comfort, right?
Right.
Because it's one of, I think it was a Mercer. Mercer just came out with their last like CFO study, and I want to say 80%, something like 80 or 86% of CFOs said that healthcare was the number one expense that they felt like they cannot control,
Yeah.
and it gives them the most anxiety, and
Yeah.
rightfully so, right? And so it gives your CFO peace of mind, because at least you know that that GPS is there, right? Someone is
Right.
helping steer the ship. They're just not going to anywhere, anyhow, and getting into trouble. So
Right.
it gives both the patient and the company peace of mind.
And so, obviously the CFO is happy, and I'm glad you kind of went that route, because I was going to say, we've talked a lot about, like, the actual person who's using it, and then, you just touched on the CFO, but I feel like HR is also benefiting significantly from something like this, because I can't tell you, how many groups that we talk with, that some of the questions that they get are, where do I need to go? Is this covered? All that kind of
Yeah.
stuff. So, I mean, you feel like something like this takes a lot of responsibility and time. It gives HR back a lot of time. And then I feel like takes a lot of those questions off of them, where, employees are empowered to be able to find the answers themselves.
Well, it is. And I think it's unfortunate that traditionally it has fell on HR to do all of this, because it's not like they have any sort of healthcare experience. Like they went to school for HR, not for nurse navigation, right? It's a
Right.
completely different realm. It's like
Yeah.
asking a car mechanic to go look at the cake that I just made and make sure that it's all good. Like that's not how it works.
Right.
So for them, like, I mean, you hit it spot on. Most of the times, if they don't have a navigation service, employees just go to the HR personnel for, where am I in my deductible? What doctor should I pick? What's covered in my plan? What's step therapy? Like, all of those things. And so that's replaced with our benefits manager. We call it Benny, Benefits Manager AI, where you can literally ask it yourself, basically like Chat GPT.
Mm-hmm.
You can ask it, what is my copay for a cardiologist visit?
Yeah.
So that you're not flipping through, all those pages to find what your copay is. And so it just really does help them, because again, it's not their job and it shouldn't be their job.
Right.
And I think it's one of those things where you're asking a little bit too much of your HR people, like, quite
Sure.
literally. That is out of their realm. And again, these are people's lives. Like, let's
Yeah.
just always remember that this is someone's health that we're talking about. So you want the best person to help navigate them through that. So our HR person, our CHROs specifically, have absolutely spearheaded and loved this. And we've actually seen more of a joint effort, at least in this renewal season, where it's both the CHRO and the CFO really coming together to tighten up their benefit strategy with their broker and make sure that, okay, let's rein this in a little bit. We kind of like neglected it for too long. Let's get over this hump so that we can deal with actual business.
Yeah. So what are you seeing kind of, 3-5 years down the line? What are you keeping an eye on? What are the biggest things that are kind of coming down that y'all are watching from your side right now?
I know for me, it's cancer.
Okay.
It's a very ominous topic, but I think it's not talked about enough in the benefit space. And it's if you ask me what's the thing that's keeping me up at night,
Yeah.
it's these cancer trends that no one's talking about. And I don't know if it's because the insurance industry is a little scared of kind of tackling it because cancer is it's so complex. It's such a we're still trying to figure it out, right? Even on the medical side, we're still trying to figure it out. So I can understand the hesitancy, but I've seen too much when it comes to the trends of cancer. I mean, I'm sure you're seeing it as well in terms of the rise of cancer cases.
Yep.
It scares me. It really does.
Yep.
And I don't think people, especially on the benefit side, they don't realize what's coming if we don't get a grip on this. Because with cancer, I think it's 64% of cancer patients go bankrupt. I mean, it's one of those where it's indescribable, just the financial impact of cancer, right? And
When you have high deductible plans and all that kind of stuff, you're not hitting your co-insurance until 2, 3, 5,000 or whatever that number is. And I mean, if you have that diagnosis, like you're almost guaranteed to hit your out-of-pocket max every year. And I mean, how do you continue to fund it if your deductibles are that high? Like it's I can understand it. It's scary and it's daunting and it's a terrifying thing. You're 100% right.
Yeah, and I don't know why people aren't talking about it enough. I think they kind of thought, like, I said this in the beginning of last year. I said, my prediction is that, last year's rise in premiums, you really haven't seen anything yet. Like, let's wait till next year is going to be horrible. And Kayla was right again, right? So I just had to say, I wasn't going to say that because no one believed me. And now here we are. And like I saw one that was like a 40% increase just today. And we were on the call and I was like, I mean, I said it, so I don't know I don't know what you expected, but so I don't know if it's one of those things where people thought last year's premiums, that's how high it was going to rise. Like that's it. That's a ceiling. I think it's maybe one of those as to why people aren't talking about it enough. But I think we're definitely watching cancer as we're speaking right now. We are developing even better strategies to help, not only mitigate the risk of cancer, but help our cancer patients, especially on the financial side. Because again, it's not only costly for the patient, but for the company, for the insurance company. It's absolutely ridiculous. So that's one of the things that we're definitely keeping an eye on. The next thing that we're keeping an eye on is when it comes to drug usage. I mean, everyone and their mother is keeping an eye on drug usage. But I think, and I actually made a post about this with step therapy. It's an interesting thing because with step therapy, I know doctors have an issue with it because it's kind of like stepping in on the doctor's toes. And I get that. But also from the financial point of view, I mean, these GLP-1s are just destroying everyone's financial, the reports that we're getting is insane in terms of the expenses.
Yep.
I mean, that's why most of the major insurance carriers have stopped covering it. It's just too expensive. And so when we're thinking about it, that's why one of the things that we added in our benefits manager is the step therapy promoter, because you're gonna have to do step therapy anyways, right? Your insurance requires it. So let's get ahead of it and make sure, before your doctor tries to prescribe you that really high cost drug, we're gonna let you know, hey, your insurance does require step therapy for this. here's the options, right? Just make it easier. So
Yeah.
we're really focused on the drug usage. We're really focused on cancer. And overall, we're really focused on just making our systems more in tune with other systems, right? So you're going to be seeing a lot of us in terms of partnerships, making sure that, we're every single TPA out there, I mean, we have it right now in terms of relationships, right? But just increasing those relationships further to make sure
Yeah.
that we're way more interconnected, right? We're really
Yeah.
good on the tech side. I,
Yeah.
I would argue that we're, top in terms of the tech and the quality. So we've mastered performance. Now let's make sure that we're really entering the relationship space and making sure that we're interconnected. So those are my three focus areas now up until, in a year from now.
Well, I love it. And I mean, it's been great what y'all are doing, just again, from, being a patient advocate, but also just working with companies to drive down costs because unfortunately they are continuing to rise. So I'm definitely watching to keep an eye out on what y'all are doing and how y'all are doing it. And it's exciting. And, I'm very, very appreciative of your time today. Where can people find you if they need to get in touch with you?
Yeah, so I'm on LinkedIn, so you can just type in Kayla Shawn and I should come up. We also have the Healthcare Navigator on LinkedIn as well. If you want to go to our website, it's www.thehealthcarenav, so nav.com. And we're also an app on your phone as well. So you can find us basically anywhere that you need to, and we'll make sure that you're navigated properly.
Awesome. Well, Kayla, thank you so much. I appreciate it. This was great. I hope it's very impactful for people, for businesses, for people, individuals as well. But again, I really appreciate your time and we'll definitely talk again soon.
Thank you for having me. It was great.
Thanks.